It is 7:47 at KNEB and time for our News Extra program, brought to you by Intralinks. Here's Kevin Moon.
Thank you, Dennis, and good morning, everyone. Our guests today are Pat Bastron and Elisha Miller. And Pat is coordinator of the Reproductive Health Program at CAPWIN, the Community Action Partnership of Western Nebraska. Elisha is an LPN and counselor at CAPWIN. And we're going to talk about a number of things. First of all, we're going to talk about exactly what the Reproductive Health Program is at CAPWIN, and we'll have Pat kind of explain that. What is that all about?
Thanks, Kevin. Actually, what we're about is helping people, whether they be young children, when I say children, anybody from 13 all the way up, male or female, and we want to educate them on the reproductive health. We want to help them with risk factors. We also want to do mammograms, we want to do pap smears, all the issues that would be around the reproductive health. And that's once again for male and female.
All right. So doing this, people line up appointments to do this? Is it income eligible type things? How does this work?
Most people come and make appointments, but we try and see those that don't. Most of our clientele is the low income or uninsured, but we also treat those that do have insurance.
Okay. And doing this, treating it, you also do some education things as well, right?
Education is a big part of it. We have risk factors that we want to talk about with them to find out where they're at with those risk factors and how we can help them.
All right. So you, some of the things you teach are, you teach abstinence, right?
Abstinence, yes, definitely abstinence. How to talk to partners, how to talk to parents, how even to talk to other counselors and explain what they really are having problems with. As well as, of course, we also have, in reproductive health, we have the contraceptives and different methods with that. Or also, if a person is thinking about getting pregnant, we can help them with trying to have the health that they need before they're pregnant.
All right. Are most of the people that walk in young folks, teenagers, a little above 20, or is it?
It's a mixture of both. Actually, we have a lot of teenagers, and when they do come in, we also share with them that their visits with us are confidential. We do encourage them to talk to their parents about it, but they don't need to have their parents to come in, and we can still help them. But we do have a lot of older women and men that come in as well. Actually, I think we're probably about 50-50.
About 50-50, huh? Okay. We'll talk more here after this quick timeout. All right, now we're going to get into the STI and HIV testing. There you go, Jan.
Computer viruses and overpaying for virus protection can cause headaches for your small business. Let Intralinks keep you protected.
So should I talk to basically Elisha about this HIV testing?
Intralinks today, 632-6590.
Oh, we'll let Pat start. We'll let Pat start. Pat can start.
By visiting intralinks.net/Facebook.
All right, we are back on News Extra. We have Elisha Miller here, an LPN and counselor, and Pat Bastron, who is coordinator of the Reproductive Health Program at CAPWIN. And one of the things you folks wanted to promote today is the fact that now you have a different situation regarding STI and HIV testing at CAPWIN, right?
Yes, Kevin, we do. There are a lot of people out there that are not aware that they are at jeopardy of having these sexually transmitted infections. They have changed the terminology from sexually transmitted diseases to infections because if we catch it, we can treat it just like an infection. The other thing is that there are a lot of people out there that are at risk for HIV, and they're uncomfortable coming in and asking for the tests. So we've made a few changes, and we're wanting people to know that they can come in and it's all confidential and they don't have to have an appointment.
All right. And you have a specific day in each month that is basically for those no appointment type things, right?
Yes, we've decided that on the second Wednesday of each month we would do a clinic from 10 in the morning till 6 at night. People can come in. They don't need to have an appointment. All they need to do is ask for Elvira, and that's our keyword, and we'll take care of them whether they just want the sexually transmitted infection testing or if they want the HIV along with it. It's totally up to them. Once again, the confidentiality is there, as well as for the HIV, it's anonymous.
All right. Let's get Elisha in here real quick before we get done. Elisha, talk about, as the LPN and counselor, your role in all of this.
I am in charge of actually doing the testing, the treating, and counseling based on a person's risk factors. So I bring them in my office, we talk about their risk factors, we decide what testing they need done, and then go from there.
All right. And when you talk about the risk factors and you counsel these folks, when they come in, I mean, we were mentioning outside, there's what, 60 people in the Panhandle?
Yes.
That your agency has tested positive for HIV, right?
Yes.
So the risk is out there, right?
The risk is there, yes, and I don't think the population is aware that it is a problem here and that they need to protect themselves.
Yeah. And there's more people maybe in Nebraska, like you said, than people think. Partly because we have money here available.
Correct.
That other states maybe don't have for this type of thing. Is that right?
Correct. At Kaplan, we have the Ryan White program that offers care to people who are HIV positive. Other states have run out of money, so we are seeing more patients come here because we still have money left to care for them.
Okay. All right. Once again, it's 10 to 6, second Wednesday of each month. And the next time they have the no appointment situation where you can go in and test for HIV or STI is October 12th from 10 to 6. Can people just go in and do that anytime though? Those are that's kind of a specific day where they can go in anytime and ask, right?
Yes, Kevin, they can come in at any time and ask. They can also call, and we'd be glad to set up an appointment that's convenient for them, whichever works out best for them.
All right. And the code word is Elvira if they want to come in and do
yes,
it, right?
if they're uncomfortable saying it in front of people, and that's understandable, we have a lot of people, then all they have to do is tell them that they're there to see Elvira, and we'll take care of it from there.
All right. One other quick note, we're just going to mention this, the farmer's market in front of the greenhouse, the Kaplan greenhouse. The farmer's market is on for this week. So from 4 to 6 p.m. at the Community Ever Greenhouse on Oregon Trail Road in Gering, the farmer's market on 4 to 6. It's kind of been up in the air whether they're going to have it or not this week. It's on 4 to 6 in front of the greenhouse. All right, very good. Thank you for coming in. Appreciate it.
Thank you, Kevin.
you.
All right, back to you, Dan.
Kathy Birch from Daniel